Multiple system atrophy MSA is a rare, progressive neurodegenerative disorder characterized by a combination of symptoms that affect multiple systems in the body. It is classified as a type of synucleinopathy, a group of diseases that involve abnormal accumulation of a protein called alpha-synuclein. MSA is marked by the degeneration of specific areas of the brain, including those involved in motor control, autonomic function, and coordination. Key features of multiple system atrophy neurodegenerative MSA involves the progressive loss of nerve cells in the brain and spinal cord. Multiple systems affected. As the name suggests, MSA affects several systems in the body, including motor control, autonomic regulation, and coordination. Types of MSA. MSA can present in two main forms, based on the predominant symptoms. MSA Parkinsonian type. Similar to Parkinson's disease, with predominant motor symptoms such as tremors, rigidity, bradykinesia, slowness of movement and postural instability. MSA cerebellar type. Characterized by symptoms related to cerebellar dysfunction, including ataxia, lack of voluntary coordination of muscle movements, gait and balance problems, and tremors. Symptoms of MSA can vary widely, but they generally include motor symptoms. Parkinsonian symptoms in MSA: tremors, stiffness, bradykinesia, and postural instability. Cerebellar symptoms in MSA: ataxia, uncoordinated movements, difficulty with balance, and slurred speech. Autonomic dysfunction. Orthostatic hypotension, a drop in blood pressure upon standing, leading to dizziness or fainting. Urinary problems, difficulty with bladder control, frequent urination, or incontinence. Sexual dysfunction, impotence in men and sexual difficulties in women. Sweating abnormalities, either excessive sweating or reduced sweating. Cognitive and behavioral symptoms. Cognitive impairment, problems with memory, concentration, and executive function. Behavioral changes, depression, anxiety, or apathy. Other symptoms. Dysphagia, difficulty swallowing. Dysarthria, speech difficulties due to muscle weakness. Sleep disorders, such as insomnia or disrupted sleep patterns. Causes and risk factors. The exact cause of MSA is unknown, but it is believed to result from a combination of genetic and environmental factors. Risk factors may include genetics. There is no clear hereditary pattern, but genetic predispositions might play a role. Alpha-synuclein. Abnormal accumulation of alpha-synuclein protein is a hallmark of MSA, similar to other synucleinopathies like Parkinson's disease and Lewy body dementia. Environmental factors. Exposure to toxins or other environmental factors may be involved, but there is no definitive evidence linking specific environmental exposures to MSA. Diagnosis. Diagnosing MSA can be challenging due to its similarity to other neurodegenerative disorders. The diagnosis is typically based on clinical evaluation, assessment of symptoms and medical history. There is no definitive test for MSA, so diagnosis is primarily clinical. Neurological examination, to evaluate motor symptoms, coordination, and autonomic dysfunction. Imaging studies. MRI magnetic resonance imaging. MRI scans of the brain and spinal cord can help rule out other conditions and may show characteristic changes in brain structures affected by MSA. CT scans may be used to rule out other potential causes of symptoms. Autonomic testing, assessments to evaluate autonomic dysfunction, such as tilt table tests for orthostatic hypotension. Laboratory tests, to rule out other conditions with similar symptoms, such as metabolic or endocrine disorders. Treatment. There is no cure for MSA, and treatment focuses on managing symptoms and improving quality of life. Medications. Parkinsonian symptoms. Medications used in Parkinson's disease, such as levodopa, may provide some benefit but are often less effective in MSA. Autonomic dysfunction. Medications like fludrocortisone or midodrine may help manage orthostatic hypotension. Anticholinergics and other drugs may be used to address bladder and gastrointestinal symptoms. Symptomatic relief. Medications to address specific symptoms, such as antidepressants for mood disorders or muscle relaxants for spasticity. Physical therapy. To improve mobility, balance, and coordination, and to manage motor symptoms. Occupational therapy. To assist with daily activities and adapt to physical limitations. Speech therapy. To address speech and swallowing difficulties. Assistive devices, such as walking aids, canes, or wheelchairs to improve mobility and independence. Prognosis. MSA is a progressive condition, meaning symptoms worsen over time. The rate of progression varies among individuals, but many people with MSA experience a gradual decline in motor and autonomic functions. Life expectancy may be slightly reduced, but many people with MSA can live for several years after diagnosis. Complications of MSA can include severe mobility issues, leading to falls, fractures, or other injuries. Respiratory problems, due to difficulties with swallowing or weakened respiratory muscles. Severe autonomic dysfunction, impacting blood pressure regulation, bladder control, and other autonomic functions. Conclusion. Living with MSA requires comprehensive care, including medical management, physical therapy, and support for daily living activities. Ongoing research aims to improve understanding of the disease and develop more effective treatments. Would you like more information on any specific aspects of MSA, such as management strategies or current research developments?